Folks, that tonight is the last night and the last day to submit your pre-grant application to the Main Street Relief Fund. Over the past 2 weeks, we've been accepting applications. We've gotten nearly 10,000 applications so far, but there is still time to get it in. It only takes a little, maybe half hour or so to fill out the form. Very simple 2-page form. You can go to revenue.nh.gov to get that, or nh.gov. Pretty much anywhere on one of our state websites, you're going to find a link right into that program. Also, the Department of Revenue Administration has the application online. So one more night to get that in, and that'll be cut off at midnight tonight. So we hope everyone that qualifies under that $20 million total revenue threshold has some time to fill out the application. We just want to be able to help a lot of those businesses that we know have been suffering throughout the large part of this COVID epidemic. With that, I'll invite Commissioner Shibinette to join us.
Thank you. For a public health update today, we are announcing 107 new cases for a total of 4,492 cases. We have 2 new hospitalizations today for a total of 440, or staying rate around 10%. We are announcing 6 new deaths today, 4 male, 2 female, all in Hillsborough County, all over the age of 60 years of age, all associated with long-term care facilities. As a testing update, we have tested over 70,000 people in the state of New Hampshire so far. We're pleased to announce 2 new efforts to expand COVID-19 tests. First is CVS drive-through testing at 5 locations in the state. It is drive-through testing, so people stay in the car. It's a self-swab. Participating CVS locations are Hall Street location in Concord, Loudon Road in Concord, Lafayette Road in Hampton, Whitehall Road in Hooksett, and Daniel Webster Highway in Nashua. Results for those testings from CVS is about 3 days, and you can go to cvs.com to select a location and a time slot to get your test. Secondly, DHHS is now offering testing for all people in the state of New Hampshire at our fixed testing sites. So asymptomatic, don't need to have any type of high-risk area. So anybody that wants a test can get a test at our fixed sites locations. So we have you can set up for testing an appointment to get a call back at nh.gov/COVID-19. Click the button that gets you to the testing website. You will get a call back from one of our people at our testing center to set up an appointment at the location nearest you. So that is all people, and we're really encouraging people to get out and get tested. We have a ton of same-day appointments available. So if you call today, you certainly can get an appointment for this evening or even tomorrow or over the weekend. So we're encouraging people to do that. Outbreak update. We have 1 new outbreak to announce at Mount Carmel Nursing Home. Mount Carmel Nursing and Rehab Center in Manchester conducted all of the testing on staff and residents. There were 31 residents that tested positive and 1 staff member. Additionally, there is a new announcement from 2 hospital partners in Manchester, CMC and Elliott, who recently just announced today that they've had a cluster of illness on their floors, their inpatient floors at their hospitals. We are working with both of those partners to do contact tracing, just giving them support where needed as we try to identify kind of the source and whether this is considered an outbreak. It is much more difficult to identify outbreaks in an inpatient acute hospital setting, as the patient population is more transient. They come in and they leave within a couple days, so it's more difficult to identify outbreaks in that setting. But we're working with those partners to help them along through that process. Can also announce that since our last update, we've had some outbreaks that have closed, and we will be starting today reporting those outbreaks, the closed outbreaks, on a weekly basis, just to identify the facilities that had long periods of outbreak activity and then managed to get through that activity and close out their outbreaks. So today, Clipper, Harbor Genesis, and Portsmouth, Hanover Hill in Manchester, and Pleasant Valley in Derry all closed their outbreaks since our last update. Also announcing our dashboard, which I'm sure everybody has been patiently waiting for, and we have been diligently working on. So we will be launching our new online COVID-19 dashboard today. It will be updated daily, and a lot of our weekly information, our demographics, and our details in our weekly report will be updated real time on our dashboard site. So you can go to the nh.gov COVID-19 today to get to our dashboard and see our daily updated demographics. That's all I got. Thank you.
Great. Well, thank you, Commissioner. A variety of different things to talk about today. Lately, Friday seems to be the day when we're making a lot of announcements, but I think it's a testament to all the work that, whether it's in the Open Up Task Force, the Governor's Office, the Department of Public Health, all the other folks within Health and Human Services and the Emergency Operations Center that are just working really hard over the course of the week to get a lot of stuff done. And we want to give folks as much of a leeway and heads up, if you will, on some of the changes that are coming. And I think they're very positive changes, frankly, as we start and continue to flex certain things open and start looking at other opportunities. So first, two areas I want to cover first is driver's ed. Behind the wheel driver's education training, a common question we get all the time concerning driver's ed. The DMV has been open in a limited capacity, and again, those tests you can go online now and reserve your test at the DMVs. Those tests will resume on Monday in some limited locations, but they will resume. And kind of working hand in hand with that is the idea that behind the wheel driver's education training can resume or may resume. I have to use proper grammar with strengthened guidance, which can be found at nh.gov. Under the Stay at Home 2.0 button. So we are resuming the behind the wheel driver's education training, and again, as a dad of a 15-and-a-half-year-old, no one's more excited than the Sununu family, frankly. Second, houses of worship. Churches and synagogues across the state, there's been a common push, if you will, to have that discussion, to look at that guidance. I know the President made his announcement last week, and that was followed by CDC guidance, which we looked at very closely and worked very hard over the course of the week. A lot of credit goes to Senator Bob Guida. Frankly, Senator Guida has worked really tirelessly, convening stakeholder groups all across the state, just looking how at churches and other places of worship could begin to hold in-person services, look at how the guidance might truly marry with the practical implementation. We want to make sure that whatever we put forward can actually be done in a real way and is actually manageable by the staff of those places of worship. So again, although we never actually closed the churches, we did limit them as part of our social gatherings to 10 or less. So we do know some churches have remained very active, doing small groups here and there, doing smaller outside type services. But we also appreciate that there is an opportunity now with our numbers dropping, looking at some of the guidance that we have, as well as the fact we have more testing, we have more PPE, we have more tools in the toolbox to really manage situations as they may arise, which allows us to flex more open. So effective immediately, we are issuing guidance that will enable larger in-person services to resume, provided that they follow that health and safety guidance, which in New Hampshire will include a cap of 40% occupancy. So 40% occupancy within those houses of worship is one of the key aspects of this. Also maintaining physical distancing with at least a 6-foot buffer between different groups. Obviously, we don't want family members to be able to sit together, but making sure that there is buffering there. So in some cases, it may mean blocking off a pew or creating greater separation between the chairs or whatever it might be. But all that is built into the guidance, and it was all done with that stakeholder input. So hats off not just to Senator Guida, but all those folks that really participated in that, and that can all resume effective immediately, frankly. Next, an area we've been working very hard on for many, many weeks revolves around hotels and lodging. On Monday, April 6th, we closed hotels and short-term rentals for what we kind of deemed as leisurely purposes. We did keep them open for essential workers and vulnerable populations, such as victims of domestic violence or child abuse, things of that nature. We wanted to make sure that they would always have a safe place to stay. But for those leisurely and vacation travelers, so to say, we really put the clamps down on those rentals so as not to incentivize folks specifically from out of state from coming up here are bringing and from areas of higher impact of COVID up into New Hampshire. We knew that could be a recipe for a lot of problems without, again, the testing and PPE capabilities that we have today. So today we are announcing that hotels and short-term rentals may resume on June 5th. That's this Friday, June 5th. Effective immediately, hotels, inns, bed and breakfast, short-term rentals like Airbnb can start taking reservations from in-state residents and those of out-of-state who have fulfilled a 14-day quarantine requirement in their home states for a check-in date beginning on Friday, June 5th. The guidance we're looking at actually is very similar to what you might find in Maine or Vermont. They're all a little bit different, but very similar, I think, in tone and approach and spirit in terms of making sure that we're allowing those businesses to flex open. We're really making sure that they're working with individuals that have either quarantined or are from the state of New Hampshire. And those check-ins will have to self-attest to that fact if they have quarantined or either show a New Hampshire driver's license or self-attest to the fact that they have quarantined for 14 days as we are requesting them to do so. Hotels and inns with fewer than 20 rooms may rent out at full capacity. So the smaller facilities we want to be able to rent out at full capacity, just knowing that the economics wouldn't really work, frankly, for limiting them. While hotels with more than 20 rooms, we're asking to limit occupancy right now at 50%. And hotels and inns with direct outdoor entrances on their rooms, what we call kind of outdoor hotels and motels, they can book at full capacity as well. They just don't have the internal congregation areas and hallways that can create some of the issues around the virus spreading, and we want to make sure we're doing what we can to mitigate it while still flex open the opportunity for hotels and lodging specifically for New Hampshire residents. So again, we just appreciate everyone's patience in working to find a viable solution. And again, we believe the guidance we're putting out today is a solid foundation to at least get the ball rolling, get started. And we'll watch the data over the next few weeks and hopefully be able to make another step forward if the data looks good and we maintain on a positive track. Hopefully we can make another step forward in a few weeks, but you got to make sure that you're not just looking at a single data point or a couple days, really looking at the trends that are coming out of the decisions that we're making. But we feel very confident in working with the Department of Public Health and all the different stakeholders that this is a great start. Next, we want to talk about day camps. Day camps are really essential in New Hampshire. As governor, I've had an amazing opportunity to visit so many of them. We talk about the YMCAs and the Boys and Girls Club or some of the smaller private camps all across the state, providing incredible opportunities to kids. It isn't just the fun and games and the enjoyment of going out in the summer and going to a day camp. For some of these organizations, they might be providing the only meal of the day for those kids. And to have them open and operational to provide not the child care services, that's a very different operation, but still has some of the same results in allowing parents some of the flexibility to go back to work as we flex things open and to be, as we kind of call it, that new norm. Day camps are really, really important all across the state. So we worked very hard, and again, our hats off to the Department of Public Health who really dug into this very, very deeply. We're going to allow day camps to resume beginning on June 22nd. So that's still about 3 weeks away. But again, we want parents to have the heads up and be able to plan into the summer and know that that opportunity will be available. If those camps choose to open, we're not forcing anybody to open, of course, but if they choose to open, we want to make sure those parents in those communities know that they'll have that opportunity. The benefit of day camps is that the vast majority of kids are from those communities. They are from New Hampshire and those towns and communities, and it doesn't really create a cross-border issue, which a lot of these other industries, that does have to be taken into account. Not so much here, but we do have some pretty robust guidance. It is now posted at nh.gov, again, under that Stay at Home 2.0 button. So we recommend that anyone who's associated with one of those day camps or affiliated to download that guidance, get familiar with it, and of course we have a few weeks to take any questions or concerns that folks might have, but we want to make sure that the parents and families of the state know that day camps will be operational on June 22nd. Also regarding overnight camps, we're making kind of a half announcement today, if you can bear with us. So we're announcing that it is our plan to reopen those overnight camps starting on June 28th. That's 4 weeks away. The guidance document we're still working on. We're still really digging deep. Very different dynamic with overnight camps, given that so many of those kids can often come from out of state. So we're looking at different quarantine provisions or testing provisions that might be able to be put into that document to make sure, again, it's practical, something that the camps can manage, something that the state can manage or those communities can manage if there were we were to find out if someone was COVID positive, what we would do. And we're just really dotting the I's and crossing the T's. But overnight camps, it is planned that they will be able to resume on June 28th. We're making that announcement announcement 4 weeks in advance because, again, we just know that those organizations do need time to staff up, prepare, get those camps up and running. They've essentially been mothballed, since last summer. So it does take a little time to get those up and running, but that is our plan, and we expect an announcement early next week, and with the final guidance document as well. But we want folks to know that that is hopefully where we're headed. And finally, I just want to take a moment before we close, a couple more things. Stay-at-home 2.0. So the question was whether the stay-at-home order would be re-upped. It does technically expire tomorrow, or today or tomorrow. We are going to re-up the stay-at-home order for another 2 weeks. We'll be extending it for 2 more weeks as we continue to flex open. That's what the 2.0 is really about, our ability to flex open some of these businesses. And we're really still in that period where we're constantly looking at organizations that we can provide an opportunity to, those initial opportunities to flex open. So that's really why we're going to be staying in it for another 2 weeks. But it is our hope and intention to move beyond it on June 15th. That's the hope. And again, we'll watch the data, see where we are, see where some of these businesses and opportunities that we flexed open, see where their data lies, do some of the contact tracing if it's necessary. But about 2 more weeks, and then hopefully take that next step into a different look, and again get our summer going. I think really as folks would like to see the summer going. There's still going to be a lot of restrictions in place. We're never going to really be at the point where we're 100% open in just a couple weeks. That's not likely not going to happen. I mean, we just had another 100 new cases today, but it is manageable. Remember, all this was done. We remember that term flatten the curve. We used to mention it 5 times a day at these press conferences. That's what this was really about. And it's the flattening the curve is about creating an opportunity for the healthcare system and our hospitals or whatever it might be, the testing capability to all be able to manage if there were another surge. I've always said I anticipate another surge coming in some way. And just because numbers might go up for a few days or even a week, or down for a few days or even a week, it doesn't mean we have to take drastic measures one way or the other, because we've created a system that can truly manage the capacity and the need if it were to arise. And our hats off to all the different hospitals and healthcare providers in the state, our National Guard for setting up those surge centers, and we're going to have 4 of them that will remain active. Those are all key elements to allowing us to have this flexibility that we just didn't have when we first entered the stay-at-home order. We have those tools at our discretion now, and folks are doing, I think, a lot better in terms of creating that dynamic in their lives, in their communities, and in their workplace to really understand where we need to go and the responsibility we all have. And we'll continue to have through the rest of the summer. So we'll continue to flex things open over the next couple of weeks, and then hopefully transition out of the stay-at-home order on June 15th. One more thing I do want to talk about, frankly, and I guess it's just more of a personal issue than anything, and I think it's personal for all of us, and that's what's happening out in Minneapolis and Minnesota. We've seen some of the tragedy out there in a variety of ways, and folks have asked me, even just this afternoon, were asking me about the protests, and of course the protests are terrible, but let's not remember about the event itself and the family. And that poor individual that was killed by those police officer, that's what this is really about. And that's what strikes home. And what I guess I just wanted to do is take 2 seconds and just reassure the people in New Hampshire that we are absolutely on top of it. We not just continue those discussions, but we're constantly elevating them with all parts of our community, with members in the African-American community, the NAACP, the minority community throughout New Hampshire. We created, just 2 years ago, I created a Diversity and Inclusion Council, a commission that really has gone around the state talking about implicit bias and some of these things that we tend to take for granted a little bit over time. We created the first civil rights unit within the Attorney General's office. I mean, the last state to do so, but my goodness, finally we got it done a couple years ago when I became governor, and we're very proud to do that. It's been a great unit over there. It's allowed us to stay on top of issues like that. But let's not kid ourselves. An issue like that can happen anywhere at any time, and we need to make sure that we're on top of it. And we have amazing law enforcement in this state. We really do. Our state police on down to the local law enforcement, our first responders that are always on top of emergency situations. We're incredibly fortunate, but that doesn't mean we're not going to stay on top of it. And I was talking to Commissioner Quinn earlier today, and just talking about making sure that those discussions are ongoing. We're building it into our training. We're being very cognizant of what happened, and that it isn't just one situation. We see these situations play out in a variety of different ways over the years. And again, it doesn't mean that we're immune to it, which means that we constantly have to stay vigilant on top of the issue ourselves. But that was a tough one, I think, for all of us to see. And look, from from the governor to that family, my gosh, our heart really does go out to them. And but here in New Hampshire, we're going to stay right on top of it and do what we can to learn from it and make sure that we maintain the best and the brightest in our law enforcement community. With that, we can open up for questions.
So on that topic, Governor, there was an arrest of a man in Albany last week that was big on social media, and African-American man who claims that he was mistreated by state police because of his race. Is that something that have you looked at the video?
Sure.
Is it something you think the state ought to look into?
Oh, absolutely. So there was an incident about 9 days ago, I believe. So there was a video on social media, and we made sure that as soon as that entire incident came to light, the Attorney General's office has been on top of it, working very closely with both local and state law enforcement. As far as I know, to date, no complaints have been filed, but we're going to stay on top of it to be sure and make sure that if there was anything there to be additionally known about it, other than what was in the video, we're gonna dig in. It's those types of issues where you can't just say, yeah, no, it looks like we're good, we're okay. You got to stay right on top of it, dig right in, and make sure that again all the I's are dotted and T's are crossed. And if there was anything wrong, we'll address it. Right now, there's no complaints, but we'll stay on top of it.
Do you believe that what you saw in the video, the troopers acted appropriately?
What
Do you believe the troopers acted appropriately
in the Albany video,
New Hampshire situation?
the New Hampshire situation? I can say that so far, in terms of my discussions with the Attorney General's office and the Department of Safety, all indications are yes. But we're going to keep looking into it. I mean, it's not a closed deal yet, to be sure.
One thing that was in the video, one of the troopers that was pulling the man out of the car didn't appear to be wearing gloves or facial covering.
Mm-hmm.
Are there guidelines for PPE use by law enforcement?
I have to be honest. There are guidelines. I couldn't speak to them in detail. I apologize. I don't know the exact details. I'd probably refer to either the state police or Commissioner Quinn for more details on that.
Regarding the sleepaway camps, how are the kids going to get here? And transportation, buses, I know this is part of the problem that you and Dr. Chan and the team are working on, but logistically, what is the biggest issue for the sleepaway camps?
Logistically, one of the big issues we have is around transportation. So for example, I mean, there's a lot of issues, to be honest, but for example, if they were to fly in, typically we are asking people to quarantine for 14 days if they were to fly here. There are ways to mitigate around that. Now that we have more testing capability, maybe we can add that in. And just making sure that those communities would be available, be available and know how to deal with if someone were to come down with COVID on day 5, let's say. So what are the operational procedures? How would you manage that? I think a lot of folks have a lot of concerns about that, and rightly so. So again, I can't provide any more details than that because we're still working on the guidance document. And there's still a lot of issues to work out, but we feel very confident that we can get there. I'd also just add a reminder that whether you're talking about these day camps or sleepaway camps, again, it's not just fun. I mean, it is fun, don't get me wrong. But it really is about an amazing opportunity, especially in these times, to allow these kids to get away. And I don't know anybody who doesn't need to get away. I'm not going anywhere, but and just get away from some of the anxiety, especially a lot of kids out of the inner cities, right, where you're in very, very difficult, anxiety-filled situations in a whole new. I mean, you walk out onto the street in some of the cities now, and they're barren. I mean, for understandable reasons. Everything is just different, right? The anxiety of what can happen at home, and the benefits of being able to attend these camps or sleepaway camp or whatever it might be. There's mental health benefits. There's just a variety of ancillary benefits there that we don't want to ignore, and which is why we're going to make as strong of a push as we can to try to get them open. And again, we're giving ourselves a month to get there. We want people to actually be able to gear up and plan for it. And I think within a month we can find a reasonable pathway. It might not be perfect. None of this is. None of the guidance documents that we put together are perfect by any means. But given that there's really no playbook, it's never been done before, we're trying our best to kind of craft something that works for us. We're also looking at what other states have done in this area, and a lot of other states have already announced that their overnight summer camps are going to be open. And so, we're kind of working with them to figure out how they worked through some of these issues as well. We have to craft it for us, but and do the best we can, knowing that it's not going to be perfect, but to create that opportunity while maintaining as much of the aspects of public safety and viral mitigation as we can is going to be very important.
Governor, with regard to houses of worship, this seems like a turning point, meaning that it's certainly not a return to normalcy, but people have been missing this part. in your lives until now, and I wonder if you could speak to that.
Sure. There's been a lot of passion, if you will, around the idea of opening houses of worship, and rightly so. One thing I've always said as a governor, I think it's true for anybody, whether you're a governor or whether you're in the 4th grade, you need something that grounds you. You do. And for a lot of us, it might be family or faith. It could be anything. It could be something different for everybody. But for a lot of folks, it is their faith. And that's a very personal thing when that gets interrupted. And I think a lot of people understand why it needed to be interrupted, and especially early on with some of the earliest outbreaks, transmission here happening in a church setting. And I think everyone was very cognizant and responsible about saying, okay, well, maybe we have to take a step back and take a pause. A lot of those houses of worship closed voluntarily, said, well, we don't want to do that. A lot of folks were doing online services or drive-up services, things of that. I applaud them for being very innovative. But it is an integral part of so many individuals' lives, so many families' lives, and an integral part of really keeping so many communities together. It's kind of the glue that binds a lot of communities. And so that's why there's rightly a lot of passion behind it, and why when the CDC did finally come out with guidance for it, we jumped right on top of it. And again, we're not waiting. We're making it available immediately.
Expressed some hesitation earlier when it comes to houses of worship. You didn't want to have pastors or priests or any other religious leader with a clicker out there.
Yeah.
But that effectively is what's going to have to happen.
Yes.
So how did you get over that part of it?
Yeah, so what we saw is frankly, that was an area where I talked to other governors, how it was being managed, and they said it was actually being managed very well. And it wasn't that they were standing out there with clickers counting the number of people coming in, but they could kind of either segregate off certain pews, for example. And there was a Catholic church that I spoke to another governor about in another state that was segregating off certain pews, and then just kind of, they had a greeter at the door kind of helping people find their seats and whatnot, and just kind of being able to control the crowd that way. And I hadn't heard of any situations where it got to be a difficult situation where it was a packed house, so to say. Some of the ancillary aspects of church, like the child care and things of that nature that often happen, where we're going to ask them to postpone that. That was actually their recommendation. We're asking them to limit that personal, that physical interaction that sometimes happens in different faith communities. So we are placing, other than just the 40% restriction, there are some other limitations there. But a lot of it came all from what they recommended and what the CDC recommended and what a lot of other states are already working with. So we feel very confident going forward. It's something that can be managed, and hopefully as we see some numbers drop and we get into more of a management situation, maybe we can take another step forward. But if you're ever going to start talking about allowing people to gather in large groups together, the first place to start is probably with faith. That kind of takes the top of the priority list.
For the commissioner, regarding health, regarding testing, I think before there was a thought that maybe if we had opened up testing to anyone in New Hampshire, maybe we might get overwhelmed. Has anything changed, and how do we get to now making it available for anyone in the state?
So what we've seen for the last week or so is the demand for our tests drop. So we've seen when we originally opened up our 9 fixed sites, we had the 15 or 16 hours a day that we were manning phone lines and doing appointments. We were overwhelmed with the amount of phone calls and inquiries to book appointments, and now we're seeing our test sites testing at about 70% capacity. So being able to, if you call today, get an appointment for today. So as we've seen demand start to wane off, you've noted last week we opened it up a little bit, and next week we start opening it up a little bit more. And that's what we're trying to do, right, is just to even out the demand so that we don't overwhelm our testing centers and our lab and things like that. Even during so right now we're in the middle of doing that nursing home testing, the serial testing and things like that. And we're about to contract that out to get some help with that. But why we're doing it, we're at a point where we're testing about 10, 12,000 people a week just in long-term care every 10 days. So that can be overwhelming to our system. So as we start to look at moving that to get help with that population, we need to start opening it up to the community more.
If someone was recently a patient at CMC or Elliott, should they now get a test for COVID-19?
Anybody can get a test, and if they were a patient that was in contact with the unit, the staff, the other patients that have tested positive, they'll be contacted either by Elliott or CMC or by Public Health or maybe even by both. We're both doing contact tracing on this. Like I said, hospitals are more difficult to establish outbreaks because of the transient nature of acute care population. They don't stay there. But if they would like to get tested and they're having symptoms, or if they're having symptoms, they should get tested. If they would like to get tested, they certainly can. If they had any exposure at all or any type of close contact exposure, they will be contacted by one of our entities.
So on testing, it appears that the numbers that the state has been reporting, there have been some revision to the numbers, often downwards. If my math is correct, in the last week, the totals were dropped 500 beneath what they had been initially reported by the state.
I don't know what report you're referring to.
Okay, well, I mean, I can.
Yeah, I'm not aware.
Numbers that make us. I'll just ask a clean question then.
Yeah.
I mean, the numbers seem to be revised.
The only time the numbers are revised is if in our investigation we find that someone in New Hampshire or someone that we had reported in New Hampshire now lives in, they live in Massachusetts. Maybe they were tested as part of the nursing home outbreak testing or something like that down in Salem or somewhere like that, and we find out that their actual home is in Massachusetts. But that amount of fluctuation between numbers, at most is a couple, right? You're talking maybe 10 or less. So having a change in 500, I've never seen that in our data.
Is it the current
Over the
cases?
course of a
Maybe
week.
the current COVID cases? Which is
Are you talking about current COVID cases?
No, I'm talking about just tests, the raw tests, the PCR results
So,
have been reported.
right. So what happens often is that you have late tests being reported in. So for an example, the inpatient hospital tests, they get reported a day later and they get added in. They can range anywhere from 200 or 300 every day. So that could be some degree of fluctuations. But we have things trickle in over the week and we adjust the numbers accordingly, but I haven't seen like 500 adjusted in a day. Over a course of a week, yes. As hospital numbers trickle in, yes.
I'm just wondering if your office has issued any guidance for towns and cities when it comes to property taxes. If folks are concerned about paying their property taxes, is there any leniency just in the crisis?
So the question is about guidance around property taxes. I have a weekly meeting with conversation with the Municipal Association and all the different mayors. It's something that comes up quite often. And we work with DRA as well. So DRA really helps help monitor at a state level the property taxes. So it is a concern, I think, for a lot of cities and towns what is going to come in, given that a lot of the property taxes do come due in June. One of the things we feel pretty confident about with property taxes, I think our initial fear was that it was going to be a big problem, and I think it'll still be somewhat of a problem, is that because unemployment insurance is so high, even if you have been laid off or you're at home because of a concern over COVID, because of this extra $600 per week that people have had the opportunity, it should be allowing them to pay their rent or their mortgage or their taxes. Things like the Main Street Relief Fund is designed around the idea that you can pay your rent or your mortgage or your property taxes. A lot of these programs have been designed to allow those dollars not just to be given to the entity that's receiving it, but allow it to kind of filter right through to the economy, if you will, so they can make sure that they're keeping up and we're not driving ourselves into long-term debt or short-term debt with some of the families. So we don't know exactly what the numbers are, but I feel confident with all frankly, the trillions that have been put into the economy from the federal government. It'll clearly have a positive impact on individuals' people's ability to pay property tax, but we won't know for sure what the final number is. And then when you add on top of that, even if there is a shortfall, I'm still hopeful that some fashion of the federal stimulus bill, assuming it can get passed, and I think it will, it's my gut reaction is that will, and talking to some of the congressmen and the senators, is that something actually can get passed that will provide some type of revenue relief for not just the state, but cities and towns as well. So there's a couple different opportunities there, I think, to make sure that we're covering that base. But if at the end of the day, when the federal money is spent and we've trued everything up, if there's still a need there, we can see what the state can do to actually help. But I've told everyone, and I start almost every one of my conversations with the mayors and the cities and towns off in the same way. I say, look, get ready to tighten your belts. I mean, we can't think that we're going to go through an economic crisis without having to make tough cuts. Everyone's doing it in their homes and in their businesses. Why shouldn't states and cities and towns have to do it as well? And those are tough decisions, to be sure, but ones that I think that people understand, and every town has to make, find their priorities. I always use use the term sacred cows, right? There are certain things that are just sacred to us at the state level, whether it's DCYF or programs around abuse and mental health and SUD, things like that, that we just know if you pull back now on those programs during tough economic times, history and data show that you're really making the problem exponentially worse. So those are different programs at both the city, town, and state level that I think we need to keep our eye on. But my guess is that we'll all have to make some type of cuts or management decisions in terms of our budgets in some fashion, as we probably should.
You mentioned the unemployment, Governor. When stay-at-home 2.0, if that potentially gets phased out in a couple of weeks, that changes the formula for unemployment as well, right? That sort of lifts the umbrella off. You feel that's the right time to sort of have people come back to work?
I think so, yeah. So we looked at that. When stay-at-home 2.0, when it ultimately goes away, hopefully in 2 weeks, when it ultimately goes away, it will have an impact on the state's ability to continue, or we'll be limited in our ability to continue some of the very broad unemployment insurance eligibility and benefits that we have created. Given that more folks are going back to work, we're starting to flex businesses open, and we think it's a nice transition time into that, of course. And the federal unemployment insurance program will still be there as well, so there's still an opportunity there. It doesn't mean we're still going to have a lot of folks on unemployment and a lot of money going out the door, to be sure, but it will mean that we have to transition some of our eligibility requirements and the amount that we can pay a little bit.
You're facing another legal challenge to the declaration of emergency in regards to education. I'm just wondering if you might be able to weigh in on this. There's someone who's alleging that the remote learning is not, quote, adequate under the Constitution. What are your thoughts on that in terms of this new legal challenge?
Let me do this. I'm going to do my best not to comment on the legal challenge. I haven't seen it, so I don't know exactly what the challenge is. But let me just say, well, of course remote learning is not as robust as being in a classroom. That's obvious. We're in a pandemic. There's a reason why governors had to put in state of emergencies and what we had to do at the federal level as well. There are obviously going to be many shortcomings in our businesses, in our communities, in our schools. The fact that remote learning was so successful here, as successful as I think any state in the country, frankly, I think is a great testament to the Department of Education. It was not a perfect system in that a lot of things just fell through the cracks, to be sure. We always knew that was likely going to happen. Certain communities were going to have certain opportunities than others. Maybe it's because of the connectivity or because of availability of workforce and teachers or whatever it might be. So there's a variety of reasons why it might have worked a little differently. But overall in the state, it worked amazingly well, much better than a lot of us thought it would, to be sure. We're all very optimistic, but it really went off very, very well. Some of my biggest concerns in that area do revolve around special education. We had a lot of communities that just for various reasons were not able to fulfill the special education requirement as we wanted them to. Sometimes it was workforce or teachers not being able to or not having the ability to come in and do the one-on-one like we had envisioned it to happen. That's okay, other than the fact that we know a lot of those kids have fallen through the cracks, and that's why I have some other additional discretionary dollars for education at my expense that I can use to make sure that we're creating more robust programs, not just through the summer, but as we enter the next school year into September, October. I'm going to kind of keep some of that money in the back pocket, if you will, of education, of the Department of Education, so that when we can more clearly identify where those gaps are, those programs are there. We're making them more robust. We're not letting things fall through the cracks, to be sure. Unfortunately, I can't speak directly to the lawsuit, other than to say, yeah, of course it didn't work as well as it works in a classroom. I mean, I hope that's not a shocker to anybody, but they did a fantastic job. I mean,
Governor, with regard to indoor dining in restaurants, 33 states now offer it, and some of those states are doing worse in COVID than we are. I know you're hearing from folks in the industry. I know you're somebody who probably knows more about the industry than maybe anybody else who held this job before. What do you say to those folks who are saying, we're going to go under, or we're going to have to lay off these people we brought back with outdoor dining because it's just not making enough?
Sure. No, we know outdoor dining is just a first step, and it doesn't make a business whole by any means. And it's really allowing a business to only get a fraction of the economic opportunity that they could. Again, our hope is in the next few weeks, if the data bears out, we can take another step. I don't know what that step will look like. Is it half capacity indoors, or we're really not sure exactly. We're looking at some of the different models. We're looking at as you mentioned, other states have already taken that step, which is an opportunity for us to look at that data. The other issue that's really going to come up, I think, in the coming weeks, specifically as it pertains to businesses that took PPP PPP funds, PPE and PPP. Let's not get them too mixed up. But the PPP money, $2 billion or more, frankly, came into the state to help, at least in the first round of PPP. A lot of it was hotels and restaurants. That was an 8-week program. That program for a lot of folks will start dissipating out around mid to late June, which it means that those businesses are going to come into conflict and say, look, I haven't been able to open with outdoor seating. I have to make a decision whether I'm closing and putting all these staff on unemployment because they've been paid through PPP funding, or whether we can expand deeper, or whether they go bankrupt. That's a big inflection point for a lot of these businesses. It's not a point that is lost on us at all. So I think our hope is that in the next few weeks we can, even if we're not making that move right away to go to 50%, we'll at least have a better sense of the timeline that might get us there and give some of these businesses certainty. Again, you got to look at all the impacts of what's happening out there, not just the direct public health benefits and detriments of COVID-19, but the aspects of bankruptcy and mental health and people going on unemployment and all of that. Those have all have big implications in terms of a person's health and an individual's health and a community's overall health. The economy is a big part of that. Public health and safety has to come first in paramount. We always know that. But there are other variables there. And if we can at least give people a sense of certainty, just from a business standpoint, businesses want the certainty more than anything. If you drag out 3 months of a maybe, that's actually worse than just giving the no right up front sometimes. Right? And so I appreciate that from a business standpoint, and which is why we're trying to, I know it's difficult. Every day that goes by seems like a month for some of these businesses. Every month that goes by seems like a year. And so waiting to see when we can actually flex things open. We're not there yet. There's still a few areas and few industries where we're just not there. And 50% occupancy in a restaurant we're definitely not there yet. But if we can maintain these positive trends and get there in the next few weeks, I think that'll at least help businesses have some certainty that there is a pathway there and a light at the end of the tunnel. Want to do some on the phone?
The next question comes from Holly Raymer with Associated Press. Holly, go ahead with your question.
Hi, could you give an update on where things stand in terms of testing all nursing home residents and staff, and the Sentinel testing program that's been mentioned previously? How is that coming together? When will that start?
Thank you. So the baseline testing for nursing home residents, all of the specimens, I would say 95% are back into our lab. There's still about 5% that the facilities have the swabs, or they're just doing the specimens today, and they should have back into the lab. So the public health lab has been testing them all week. If you look at our testing numbers, you see them up in the 800 and 900 range. That's what that is. The staff, vast majority of them are done, if not all of them. I would have to go back and get my exact numbers today. There are additional facilities scheduled through the weekend, and the Sentinel program will be released probably either Monday or Tuesday, the written document. And then we will start the every 10-day testing of both of all staff and 10% of all residents in nursing homes that are not in an outbreak starting next week. So the baselines will be done, and the Sentinel will start next week.
Thank you.
The next question comes from Paul Hayes with the Caledonian Record. Paul, go ahead with your question.
Thanks. Just 2 quick questions. One, is anything being done to specifically help Chambers of Commerce stay afloat, and why does that matter? And 2, with hotels and lodging reopening, there's concern up here in the North Country about the influx of outsiders and a spike in COVID cases. Have you projected anything out specifically for this region, and would you address those concerns?
Sure. So the first question revolves around chambers of commerce. I believe most chambers of commerce are deemed a non-profit or a not-for-profit, and therefore they could apply for funds out of the not-for-profit opportunities. I think we put in $60 million into the charitable foundation that can help fund those. And obviously, chambers of commerce are vitally important. They help get our message out, or the message from the state, or the message from the industry, keep folks connected. When you're running a small business, especially a new business, you're at it 24 hours a a day sometimes. So to have an external entity in your community that's helping you stay on top of some of those other community issues and business-to-business opportunities, whatever it might be, is great. So, we know a lot of them. Chambers of Commerce never make 2 cents. I mean, they really don't. They live on a shoestring budget. God bless them, and they do great work. So if there's opportunities through the nonprofit foundation, the New Hampshire Charitable Foundation, that's there. And if there's other opportunities that need to come to bear, we're definitely open to that. I was texting with Executive Councilor Cryans about that issue specifically, so I know that's been a hot topic, especially in the North Country and in the Monadnock region part of the state. Secondly, I apologize. Are they still with us? What was the second part of the question? I'm sorry.
I was just saying, with hotels and lodging reopening.
Oh, the influx of yeah. No, so the question is really about our projections and what we anticipate to happen in terms of folks from out of state coming in. Again, right now we're asking folks to just take reservations from New Hampshire residents. I mean, we're definitely very cognizant of that issue. We know there's a lot of communities that really don't have a whole lot of COVID in it that are concerned that with hotel and lodging opening up to folks from out of state right now, that could be really driving an issue that we're not really prepared for. It is heartening to know that as we see the numbers go down in Massachusetts quite precipitously, that's good, or New York or New Jersey, Connecticut, all these states are trending on a very positive path, and so our hope is to kind of marry up their downward trend with the ability to eventually open up to more to out-of-staters. Out-of-staters can still make those reservations, but they are subject to a 14-day quarantine, of course. So there's that opportunity, but we are keeping it limited right now until everyone can hopefully be on a positive trend, not just locally, but even nationally, to address the issue and hopefully mitigate those concerns.
The next question comes from Paula Tracy with In-Depth. Paula, go ahead with your question.
Good afternoon, Governor and everyone. I have a question about ATVs and outdoor attractions, such as the Polar Caves, the things like that. There are noticeable numbers of ATVs heading up into the North Country, which has not, which currently has 5 cases, and a number of nursing homes and institutions like prisons that have not seen a major influx. Are ATVs considered in terms of opening up? Are there any provisions about ATV use? And then I really wanted to ask a little bit about Main Street program. I know you don't have numbers yet, but what is your sort of hope in terms of, I know there 10,000 seems like a lot of people. Do you think there are people that will be left out in the cold that won't get any money? And how are you going to distribute it and when?
Sure. So let me take, I think there's 2.5 questions there, if I may. The first one's about ATVs, and again, ATVs are part of our smaller outdoor attractions. There's a lot of natural physical barriers and distancing having to do with ATVs, and so those parks are open and available. I believe on both the rental side, because that comes under retail, as well as just the outdoor recreation side. So they are open and available. I think there was a slight question about polar caves in there, which I'm a big fan of, Lost River, Polar Caves. And we're going to make some announcements next week concerning more outdoor tourism attractions and other tourism attractions. And so we're really digging in deep with the Department of Business and Economic Affairs and working with Public Health to really look at a granular level. It doesn't mean all tourism attractions and all amenities are going to be open, but in amusement parks and things of that nature. But we are trying to find a way to make some flex provisions to flex open as their season really gets underway. Polar Caves would be something under very strong consideration. And finally, you asked about the Main Street Relief Fund. So we have about 10,000 businesses that have already applied into the Main Street Relief Fund. We imagine a few more last-minute applications will come in today. We have $400 million currently allocated to the program. We can make it more robust if we deemed it necessary. But again, in terms of will folks be left out, if you don't apply, you can't be left in. I'll tell you that. So you have to get the pre-grant application in. And for those who do apply, as long as you meet those stipulations of being under $20 million in revenue, and we'll have an algorithmic formula that really allows everyone to get kind of their pro rata share based on projected losses. It is being done through the Department of Revenue Administration, so there is an auditing provision here. If folks were to not directly and intentionally misrepresent their projected losses, but maybe they end up having a better year than anticipated. There's always we'll have provisions in there to be able to deal with that as well, so that again there's auditing and accountability in the system, and to really remove and reduce the amount of fraud, waste, and abuse within that potential system. So I think we've dotted our I's and crossed our T's. If you qualify, you qualify. You get a check. If folks don't qualify because they're too big or they don't apply, then they can't. If you don't apply, you don't apply. You're not part of the program. But I think we've created a program that, in talking to other governors, I think we're one of the only places in the country that has a program like this. It's really simple. Everyone gets kind of their pro rata share, their fair share, so to say. It takes a little extra work. Some states are just handing out checks to everybody, whether there's losses or not, and that's fine. I understand why folks may want to do that, but here we tried to be a little more innovative about what we did, a little more creative about our approach, and we think it's a program that's going to work out pretty well. The next steps, just to add a little more in there, the next steps are we're looking at a preliminary assessment of the data. We'll start looking at that this weekend and early next week, and finally the final grant documentation will go out hopefully sometime next week to all those who are in the final qualification, as long as we kind of dot the I's and cross the T's. We have a lot of folks that have applied that clearly don't qualify for various reasons, but they wanted to put their name in the hat. We get it. So we just have to kind of sift some of those folks out that just don't meet any of the qualifications, and make sure that those that are getting the final grant application are those that fit under the umbrella of the small business restrictions.
Question comes from Michael Graham with New Hampshire Journal. Michael, go ahead with your question.
Commissioner, we've had about 6,000 kids, roughly 6,000 kids in daycare all throughout the shutdown because of people caring for the children, emergency workers, etc. And that was before the guidance that came out that some child care centers makes it very difficult for them to operate and pay the bills. Have there been any outbreaks related to those 6,000 kids who've been in essentially unregulated daycare this whole time? And my question for the governor is, Colorado's governor gave his state metrics he was using for reopening, rate of transmission and rates of hospitalization. He was willing to put those numbers out where people could see. They started reopening back on April 20th. They're now completely reopened. They have better numbers than New Hampshire. Like most of the states that reopened, they have better numbers than New Hampshire without the draconian lockdown. Could we get a metric from you that businesses could use going forward the same way that other governments have given one to their state?
So this is Commissioner Shibinette. I'll answer your first question about daycares. We have not had any reported outbreaks in daycares. We have one daycare currently that is under investigation for having, they have a positive staff member, and we're about to do a testing event for the people surrounding that daycare, kids and workers. But right now, just have that one positive and no breaks in those facilities.
As to the question concerning the outbreaks, the data that we're looking at, I think we've been very clear about the data, the metrics that we look at. It's a % positive as well as the hospitalization rate. A lot of states have opened up. A lot of states do have less COVID that we see, and a lot of states are not 30 miles north of Boston, frankly. A lot of states are not in the Northeast. So, that's a very different situation. If you want to compare New Hampshire to North Dakota or something like that are just naturally more rural, that have naturally more physical distancing, well, of course their numbers are going to be lower. I should hope they are, and God bless them that they are. I think that's wonderful for those states. But we're in a very different situation to compare one state to another and assume that it is an apples-to-apples comparison in terms of not just the metrics that might be used, but the demographic variables, the economic variables, the community variables, they're all so different state to state. They're different New Hampshire to Maine, never mind New Hampshire to Massachusetts, and never mind New Hampshire to any state, out of the Northeast. It's completely unfair to try to make an apples to apples comparison from one state to the other and say that because one state did it, this state should too. Everyone has their own dynamics, and I think all the governors are doing a very good job, not just managing those dynamics, but communicating them, trying to be transparent. And I think it's great that certain states are able to flex open even faster than we have. They don't have the issues we have. They're not in the Northeast. The Northeast of the United States right now is ground zero for COVID in the world. That is a fact. and we still are. Our numbers are going down, but we're still here. And so, of course, we're going to govern and create our guidance a little differently, and our metrics based on hospital beds, based on hospitalization rates, based on the percent positive cases, based on the outbreaks in institutional facilities. It's all different state to state. And so I think we're doing a great job looking at our data and making good policy decisions based on that.
The next question comes from Tony Shanella with The Patch. Tony, go ahead with your question.
Oh, thank you so much. Two quick questions. First for Commissioner Chiffonnet. You know, the state during the last 7 days or so has had declining positive tests, you know, in the 35 to 75 range. And then yesterday and today, you announced over 100 positives each day. And, you know, at this point, we all realize that the data is fluctuating on a lot of different levels. But, you know, other than the 32 case outbreak at Mount Carmel, is there any specific reason for the 2 100-plus days, considering all the other days that were much lower than 100? And then for the governor, you've already commented about the 2-week extension and, you know, taking a look at all of the data after that, you know, and possibly relieving the 2.0, you know, in the middle of June. Can you just expand on that a little bit and tell us, like, how much longer you really think it needs to be extended? Thank you.
Thank you for the question. So this is Commissioner Chiffonnet. The numbers that we're reporting, over 100 for the last couple days, there's a couple reasons for them. The last 2-day part of it is our nursing home testing program. That's what is garnering a lot of attention right now. About 45-50% of those 100 new positives are out of nursing homes, not just out of one outbreak, but even out of facilities that are currently in outbreak, and we're going back and we're retesting. And some of those programs where we're going back and retesting facilities that are in outbreak for all of their residents and staff that had currently tested negative or previously tested negative are being retested, and some of them are testing positive. So about 50% of those positives are coming out of our long-term care program, not just residents, though residents and staff.
Sure. And is he still on with us? Great. So I think the question, if I may, was about the stay-at-home order and what, you know, how much longer we think it may continue on. Again, I'm just going to refer to my original statement, which is just exactly where we are. My hope is that in the next 2 weeks, we're going to flex some more things open as part of Stay at Home 2.0, and the hope is that we can kind of move beyond it into a different phase afterwards. So it's not about projecting how much longer beyond the June 15th. My hope is that we're out of it on June 15th, and that the numbers continue on a good and a strong and positive trend. It would be inappropriate to comment anything beyond that, other than that's the plan, and we're going to kind of see where we go and hopefully get there.
The next question comes from Harrison Thorpe with the Rochester Voice. Harrison, go ahead with your question.
Yeah, thank you. Governor, during the pandemic, we've been told to modify behavior several times, sometimes within a month. You know, you don't need to wear a mask. You don't need to wear a mask unless you're sick. And now please wear a mask when you're out in public. So there are a lot of Granite Staters who are getting frustrated with the constant parade of guidelines, this and that, like with the beaches, and they're getting just tired of it. New Hampshire residents consider themselves pretty self-reliant. They're free or die. Can you speak to the frustrations of some of these people, what they're feeling, and can you empathize with them?
Can I empathize with the frustrations? Of course I can.
Yes.
Of course I can. I'm living it on the front lines as much as anybody else. Nobody wants all of this to go away more than I do. Believe you me, and more than my team does. We would love to get back to just having 2.4% unemployment, all the businesses back open, everything flourishing again, no worries about a run on the healthcare system, no worries about getting PPE or testing. Has the message evolved over the past 2 months? Of course it has, because every day the situation evolves. Every day we get something else new out of Washington. We get some more PPE here. We have more testing there. We get more data here. We understand about this virus that the world had never seen before. 6 months ago, we understand more about it, how it's transmitted, what the dangers might be, what the dangers to kids might be, what the dangers to institutional outbreaks might be. That was all growing understanding of all of this as we were doing it, which, again, why I give a complete hats off to our team for being able to make decisions while things were evolving, you looking at data, being able to also say that, knowing that a couple days later we may have to make another decision. We may have to evolve this even more because it was all being done in the name of public health and safety. And it isn't about, just looking at, well, we're the live free or die state, so we shouldn't do anything. Look, we have laws and rules in the state. We're in an emergency pandemic, a state of emergency. The legislature decided, that, and I believe rightly so, that, they suspended meeting and they're going to come back into the process. I, like every other governor in this country, declared a state of emergency so that we could be rapid in our response, that we could have flexibility with how we spend funds, and frankly, we did it really, really well. I mean, really well. The fact that we could move so quickly, we could move so nimbly, we could make good decisions, and that put us in the forefront in a lot of areas of being able to mitigate this virus. So trust me, I get the frustrations with families, communities, people that want to get back to church, people that want to get back to work, people that have never been on unemployment before but have all of a sudden found themselves lost their jobs, the anxiety of just the situation that they might have with themselves, their families, or elderly family members in terms of getting COVID, the fact that we've lost so many folks to this virus, the fact that we're likely to still have more mortality because of this. But there's also some good news here, the fact that we made certain restrictions and that allowed us to mitigate the spread. There's no doubt that worked, and worked really, really well, frankly, given the dynamics that we're all facing here in the Northeast. So again, nobody's more frustrated with it than I. Of course, I empathize with all those individuals and all those families. We get it. When you're talking about businesses, I used to be in the business world. And the business world that I used to be in was hotels and restaurants, travel, tourism, and hospitality. And no one has been hit harder than those industries. I get it. I feel it. That is what has kept me up at night, night after night after night, knowing that all these businesses in all these different sectors. Some are large and can withstand, the blow to the economy. Some are small. Some are businesses that just got up and running 3 or 6 months ago, and all of a sudden this hits them and has basically sunk them and sunk dreams. I mean, people have entire dreams when they start businesses up, and that's all been dashed, right? So let's be very empathetic and sympathetic to that, to think that folks in Concord are somehow in a bubble, unaware. When we create all these processes, remember, we're one of the only states that set up an Open Up New Hampshire Commission with stakeholder input. The variety of guidance documents that folks might be complaining are moving here and there, those are guidance documents set up by the stakeholders themselves. The fact that we had the Bipartisan Legislative Advisory Board and the stakeholder group working with the Gopher Committee to help decide where we're going to spend the funds, the relief funds. Very stakeholder input. We can do that here in New Hampshire. Other states can't. Other states absolutely can't. New York and some of these big states, they just don't have that connectivity to what's happening on Main Street like I think a lot of folks in New Hampshire do. And that's a great advantage to us through this entire process. So I guess it's a very long way of saying, yeah, I get it. Great. That was one to end on. What else we got? What other questions we got?
With regard to outdoor gatherings of more than 10 people, is it possible to expand on that in the near future?
Yeah, look, we'd love to. One of the greatest limitations that we've had to put into place is the restrictions in terms of outdoor gatherings at 10 people. Well, that's a very small number. And I remember thinking, boy, that's just impractical. How do you do that, right? I mean, I remember being there and having this discussion in the office and talking to folks in Washington and folks at Public Health, but then talking to some other governors about what they were implementing and why, the data they were seeing, trying to look at the early science behind it. It was all very early science, but there was also good epidemiological studies and science behind just how general viruses spread, knowing very little about this particular virus. But yeah, we did it, and so it would be great to get out of it. It's one of the most restrictive things that we have and one of the biggest barriers we have in terms of flexing different parts of our economy open. Churches is just a great example. We're able to move forward with that today, of course, but that's just a great example of we're starting to make some steps there. And other states have gone there as well. But even things like what we're doing at the beaches, right? We're asking people not to congregate on beaches strictly because we don't want them sitting in groups, small groups, or even large groups for a large amount of time and potentially spreading the virus that way. We want to open up for active recreation, give that opportunity. So I would love to see it move forward. If that is something we can do in conjunction or shortly after the stay-at-home order, hopefully if we can get that evolved, maybe that's part of that evolution of that. There's about 20 different scenarios on the table, so there's a lot lot of ways that could go, other than to say that we hope to move forward with it. It's an aspect of the overnight camps, right? Because those overnight camps can be in larger groups. It's an aspect of childcare. And I thought they found a pretty innovative way of saying, look, you can have more than 10 kids in a childcare, but you really want to keep them segregated. Because if there were a quote, outbreak amongst one group, you want to make sure it hasn't necessarily infected another group. It doesn't mean that the whole facility has COVID spreading throughout it. So even creating subgroups within larger areas is a way to do it. We've looked at events that might have a stands, let's say, these racetracks that might want to open, or a sporting event, or Little League game. Right? Are there ways to make sure that we're keeping folks in maybe not 10 or maybe 25 or something like that, something a little more manageable, but also practical, so you can allow those events to move forward, but still keeping the groups segregated in some way. So all that is being undertaken, and we're looking at it. So again, I apologize for the long answer, but it's something that we're dealing with every single day, and some states are doing it pretty well, and there's some good ideas out there. And again, if we can just wait a couple more weeks or a couple more days here, even, we're getting more and more data all the time from folks who have already made some of these implementations. Some of it's good, some of it's not so good, and so that allows you to learn from others that have been able to take those steps a little earlier. Well, I'm looking at the clock and I'm seeing it's already 4:15, so I appreciate everyone for hanging in. That was a good one. I don't know. I think they're all good myself. So we just want to appreciate everyone for coming. We want everyone to have a good weekend. Hopefully it'll cool off a little bit. I got my air conditioner in this week. It's kind of a little weird putting it in May, but be as it may. Hopefully the weather will be okay for us. We just want people to be safe. Have a great weekend, and we'll be back Monday. We'll do it again. Thank you, guys.